Welcome to our panel addressing generational needs, healthy aging for our elders, and behavioral health for our youth in pro-COVID New York City. To kick things off, we have Dr. Naomi Dambreville, a licensed clinical psychologist and assistant professor of Mount Sinai, with her extensive expertise in many topics such as trauma, ADHD, and stress management. I know we all know about that. Dr. Dambreville is here today to share some valuable insights. Next up is Dr. Maurice Henson, the founder and executive director of MediRoots Medical Group. Next, we have Dr. Pamela Drulinski. Hello, welcome. A medical oncologist specializing in breast cancer. I'll be listening more for that. As a key member of MSK's breast cancer disease management team, she collaborates with experts across multiple disciplines to provide top-notch care. Currently the medical site director at MSK Nassau, Dr. Drulinski is dedicated to offering advanced treatments and personalized care to her patients. Our moderator is the Assistant Commissioner of Bureau of Harlem Neighborhood Health, Padmore John. Welcome. Give it up for all of our panelists. Hi. Hello, nice to meet you. Somebody needs the mic.
Hello, hello. How is everyone doing today? We've gotten some good information, right? And we're going to continue that. I heard someone say earlier that there are certain age level that's in the house today, and we need more youth. We also see that there's a lot of females in here and not as many men. And typically when we're talking about health, this is what we see. So I'm asking you, one, to listen carefully to the information we're gonna get, and then take it back. Take it back to the men in your families, the youth in your families, because they need the information just as much as you do. And the next time you come into one of the Black Health Matter events, hold one of them with you. So right away, we're gonna jump in. We appreciate the fact that you've been here with us today. Many of you were probably here last year, got some great information. And we're talking about healthy aging, right? What are the different things we can do physically to make sure that we continue to age healthy and well, that we can continue to be able to work and live in a very pleasant lifestyle. So that's what we're here for. The other thing is also make sure we're speaking about the challenges many of our youth are facing around mental health, and we'll dive into that a little bit. So before we get started, I would like to ask our panels just to introduce themselves really quickly and talk about some of the work that you do, and specifically how it can be focused towards healthy aging, whether it's getting preventive screenings, listening to some of the work that we need, as well as being able to go away with some of the resources that are required. Dr. Drulinski, I will start with you.
Okay. So I'm a breast medical oncologist, and I work for Memorial Sloan Kettering Cancer Center. And I think we're very lucky to live in New York City, where we're surrounded by so many amazing hospitals, including a specialized cancer hospital called Sloan Kettering. And we're located also with a special office right here in Harlem on 124th Street. I think you've heard amazing information. And in terms of the top cancers in men and women, lung cancer is number 1, breast is number 2, and 3 is colon cancer, and prostate is number 2 in men. I think I'll leave that to you. So you've heard about screening. And I wanted to speak to the women in the audience. As an oncologist, is it okay? Okay, I'm hearing an echo. As a medical oncologist, I can tell you that unfortunately about 3/4 of the patients I'm seeing right now are stage 4. So I don't know if there are any women in the audience with masses in their breasts. I just wanted to say, please don't be afraid to see a doctor. There are so many things that we can do for you. With the COVID epidemic, there's been a lot of misinformation about vitamins helping you and a lot of alternative medicine, but really traditional medicine is what can help you and save your lives. So wanted you to encourage to get screening, see a doctor, even if you think you have something advanced, because there's so many great hospitals in New York. There's also great programs for people without insurance, and maybe you can speak to the cancer screening programs that New York offers. With Memorial in Harlem, we offer screening for people without insurance. So even without a prescription, you can get a mammogram. I don't know if you want to speak about the CSP program that New York State offers.
Yeah, I'll let Dr. Hitson go and then Dr. Bill.
Good afternoon. Once again, my name is Dr. Maurice Henson. I'm a general internist by training. I got my bachelor's in neuroscience at Johns Hopkins University, my medical degree at Drexel University College of Medicine, and came up here to New York at NYP Weill Cornell to do my residency in internal medicine. Thank you. Currently, I work at Jamaica Hospital Medical Center as a hospitalist, which just means I take care of people who are admitted to the hospital. And I also work as a primary care physician through my company, Metalroots Medical Group, which is a telehealth-based primary care practice where we specialize in the delivery of high-value primary care by integrating medicine, so using traditional practices like herbal therapy, massage, acupuncture, sound healing, in addition to conventional medicine, which you see in our current healthcare system. Some of my other work includes being the advisor and founder of Black and Latino Men in Medicine at Weill Cornell. So this is a network of students, high school students, college students, hospital administrators, politicians that was created to help combat this precipitous decline in Black and Hispanic male physicians. And this is not to disregard our young queens from participating. We run a mentoring program where we mentor all high school and college students, irrespective of gender. But we have an issue with the number of underrepresented physicians in this healthcare system, and the challenges that we face as a people, as a community, will only be addressed once the face of medicine looks like us. All right, so lastly, my most recent work is in academic research. I'm looking at ways that we can use medical cannabis and psychedelic therapy to help with cardiovascular disease, dementia, high blood pressure, diabetes, heart disease, cancer. So these medications, albeit have been demonized in many ways, are actually incredibly therapeutic and incredibly beneficial if used appropriately. So this is one of the research areas that I'm currently involved in. It's a pleasure.
Hello. Okay. Hi, everyone. Good afternoon. My name is Dr. Naomi D'Ambreville. I am a licensed clinical psychologist. I am a child psychologist, adult psychologist at Mount Sinai Hospital and the Icahn School of Medicine. I work with adults in Mount Sinai who are medical students, grad students, the house staff that serve you guys as residents and fellows. And I'm here to kind of talk a little bit about how we can support our children and our youth and our families around their mental health and wellness.
Thank you all. I want you all to know there are tables in the back, and so some of the information Dr. Lunsky was talking about, you can gain it there. The Bureau of Harlem Neighborhood Health, our Health Action Center 115th in Lexington, we are giving out information. We're giving out COVID test kits and other resources that are helpful at this point in time. So that's a way of how you can remain connected and get access and referrals. Dr. D'Ambreville, I'm going to come back to you. We know we're seeing some of the challenges that the youth is facing right now, social media, trying to get as many clicks as possible, self-esteem. So what are some of the things that you are seeing in that practice, and what are some of the ways that we can address that and be supportive of our youth as they get through this?
Yeah, so I mean, who here has their phone on them right now? I do. I shouldn't, but I do, right? So we're all glued to our phones, we're all on Facebook, and so the internet is not a bad, hello? Can you hear me? Okay, hi. Sorry. The internet is not a bad place. In fact, for a lot of people, it's where we get our information, it's where we connect with people, and we have a good time. And so it's really typical for teens and children to want to be on the internet, especially this generation. They're kind of born with a phone in their hands, right? The concern about social media is that when it comes to mental health, for young kids and teens, it's hard for them to understand the dangers of the internet, right? It's hard for them to understand what makes a good internet friend versus an unsafe internet friend. So it's a place where really positive relationships can be built and good times can be had, but it's also a place that when we're not taking care of our kids, can really affect their self-esteem. It can cause anxiety and depression. It can cause a lot of social comparison. It can cause a lot of misunderstanding about what's important in life, right? Clicks and likes and pictures, and not necessarily things that might matter a little bit more, might be more meaningful in the long run. And so we want to kind of think about how to help kids and teens manage their social media use. And it actually starts with you all, the parents and families, and teaching them about cell phone use, teaching them about technology time, helping them set limits, helping them have things outside of the phone to spend time on, and at the same time, not withholding the phone and not withholding social media, but making it a family conversation, right? Like, you're 14, you're gonna get an Instagram account, like how can we share with each other kind of who you're following and what kind of content you're looking at, so that way you know when you're coming across unsafe content. Make it a family conversation as like, what have you heard or what video have you seen that we can laugh about, but what videos have you seen that might have brought up a topic that made them a little bit uncomfortable, and you want them to come to you as the parent, the caregiver, grandma, auntie, to sort of say, hey, what is this? Can we talk about it? So social media can be a detriment to mental health, but it also can be a tool for people maybe seeing themselves or seeing their experience in a way they haven't seen before, and it's so relatable, and that's a great thing. We also just want to keep them safe and protect their mental health.
All right. Thank you. Dr. Drulinski, I believe it has been 20 years now that the Ralph Lauren Center. Anybody here heard of the Ralph Lauren Center? Yeah. And I have to really applaud them, because 20 years ago, and I remember when they moved into Harlem, and they wanted to make sure that women in Harlem were able to get cancer screenings free of charge, even if they don't have insurance, or connecting you with insurance. So I think that's really important, and what's important about that is the investment that MSKC has done. So can you just speak to that center, what role it plays, and the importance of getting there as early as possible?
Yes. Thank you so much for saying that. Yeah, Ralph Lauren, the designer, came 20 years ago, and they're actually opening up other cancer centers around the United States to try to help improve healthcare disparities, and they're opening up in neighborhoods like Harlem. And Memorial Sloan Kettering joined with Ralph Lauren 5 years ago, and it goes to everything you've been hearing since this morning, because we just have to stop being afraid. And again, without insurance, you can get the best cancer care anywhere that's available right here in New York City. And just thank you for mentioning that. And I just encourage people to go.
Yeah, and then I think one of the things you mentioned is to try and, in terms of screenings, the importance of coming and recognizing any challenges at the early time.
Right.
So what can you
maybe
explain
we
that?
can just say that in breast cancer specifically, the cure rate is above 90% if you pick it up early with screening mammography. So if you can not fear a mammogram, and maybe you can talk about PSA screening, which is so high in African American men, and colorectal is the number 3 cancer in both men and women. So we have to get screened, and the cancer cures are so high these days, we just have to go see physicians. Maybe you can talk about prostate cancer screening a little bit. Yeah.
Yeah, and Dr. Hinson, I want to come to you especially because you're making an urgent push to increase the number of physicians that look like us. That's important. And can you just, yeah, we definitely give a hand of applause for that. We have two schools right here, Toro, as well as the CUNY School of Medicine at City College, and they're producing doctors that look like us, and that's really important. So can you speak to that importance, and can you speak to why that is important? And
Yeah, sure. So, every once in a while, I get a little bit of flack for naming the organization Black and Latino Men in Medicine, because there's always, well, what about the young women? Well, here's the thing. Our young Black and Hispanic women have actually increased the number of physicians over the past 30 years. Okay, so you're doing your thing. Our young Black men and young Hispanic men, however, have significantly decreased over that same time frame. In fact, Black male physicians have decreased nearly 30%. And we already only account for 2% of the healthcare field. So we're going extinct. So I purposely named it Black and Latino Men in Medicine, and purposely target our young Black and Hispanic men because we're almost non-existent. And when we talk about some of the issues that we face as a community and not having providers who we trust, who we can have real conversations with, who understand the different cultural nuances that exist in our community, we don't have that. And so it's understandable why you may not be so pressed to go see your doctor. Maybe you feel like you're not being heard, right? That because we have this racial, cultural difference, that they're not gonna understand the level of pain you're in, the level of discomfort, the type of symptoms that you're experiencing, the family pressure that's imposed on you, your work pressure that's imposed on you. Not everyone understands these small nuances that we have to deal with. But if you talk to someone that is of the same racial, cultural background, more than likely they at least have some level of understanding, okay? And what we find, what all the data shows, is that doctor-patient race concordance, so when your doctor is of the same racial, cultural background as you are, we tend to increase the number of preventative medical services and have better health outcomes. So this is not just something that we like to see or that we want to see, but actually has good health outcomes. And so it's imperative that we increase the number of underrepresented physicians.
thank you, Dr. Damberville. I see you want to come in, and I want to bring you into this because I know there is a paucity of clinical psychologists, licensed clinical social workers to address some of the substance use and medical health needs. So can you just speak to that, please?
Yeah. So, I mean, America is in a mental health crisis, right? Like, our children are really hurting, and you all are hurting, I'm hurting, adults are hurting, COVID hurt us all. And the issue is that if you can't see it, you can't be it, right? And so when you don't, as a therapist, you can be a psychologist and get a PhD like me, you can be a social worker, you could be a nurse practitioner. There's so many ways to be a mental health provider. But if you think about, do people even know those professions exist? Can they access that education and those professional certifications? If we don't have enough Black and brown mental health professionals, then you, the community, don't access those services. And that places a greater burden on the few BIPOC clinicians that are doing this work. The majority of psychologists, or at least mental health professionals in America, are non-Hispanic white individuals and women. So we also lack Black male therapists, Asian male therapists, Hispanic male therapists, Black female therapists, right? And it's really hard to be one Black therapist for all the Black kids, right? And so we want to give them the care, but we can't because the pipeline is kind of just short. And so we want to help people see that they can access this as a profession. A lot of that comes from having their own experience in mental health or in therapy. So if we can increase the services available, which Mount Sinai is very much trying to do, we have a pretty robust child therapy program. And And, you know, some of my own patients are sort of like, I want to be a therapist too, and I hope that's because of me, who knows? But, you know, it means that they're seeing us as clinicians and they see in me what they could be themselves, and that's so, so important, especially when it comes to mental health, because like you were saying, it's such a vulnerable space. We are asking you to open up and to share and to trust us, and it's harder to do that if we feel like there might be biases or there might be misperceptions about our race or our identity, if we don't feel like there's a good fit, if they just don't get us. So it doesn't always mean that you're gonna hit it off with like any black or brown condition, but it does mean that maybe when you first walk in the door and you see that there's someone who looks like you may have had a similar experience or even a different experience, that you might feel a little bit more comfortable, you can breathe a little bit easier. And at the same time, we want to make sure that any mental health professionals who don't identify as black or brown, that they are culturally competent, that they care, that they're not causing harm. And I think Mount Sinai really works hard to train our medical, you know, students and residents, as well as the mental health staff, in anti-racist practices.
Just wanted to say there's a lot of programs for high school students in many New York City hospitals. If you have grandchildren or children who might be interested in the sciences, they can volunteer or do internships in the summer so they can see a diverse population in terms of the workforce, which is really diverse in New York and hopefully getting better.
Going back to you, Dr. Julinski, can you explain or tell us some of the challenges that many of your patients may face that may prevent them coming into the office? What are some of the things that we can suggest to them to overcome and to make sure that they're coming in an appropriate time?
I think it's fear, and I'm sorry to say that again. I literally have 3 women that came in the last few weeks holding breasts that were the size of footballs, with so much pain and fear of seeing a physician. As women, there's a lot of female doctors. When I graduated medical school in 1991, only 50% of women were graduating from medical school. So along with men of different races, finally they let us into medical school as women. So if you're afraid of seeing male physicians, there's a lot of women in medicine now. So I think, you know, overcoming the fear of seeing physicians, and also there's a lot of women in the workforce. I don't know if there's any Hispanic of African descent here, but in the Harlem facility for Memorial, we also have a lot of physicians that are bilingual, and you can't tell, but I'm from Chile, and I speak Spanish fluently. And just so you know that a lot of immigrants are from diverse backgrounds as well, and go through many struggles to achieve success in the United States. And I encourage everyone to do summer volunteer or internships to see what all of medicine has available.
Thank you, Dr. Julinski. Indeed. Overcoming fear is something that we all have to do. It's difficult, but when we know, right, knowing is much better than not knowing. Knowing is being able to address stage 1 versus having to deal with stage 4. So that's really important that we overcome that fear, and we're able to do this not just for ourselves but for our families. I'm quite sure many of you have families at home that want you to be around as long as possible, and so do we. Dr. Henson, I want you to just talk to a little bit about some of the social determinants of health that we should be considering to ensure this healthy aging in general, but also very specifically what we are seeing here in Harlem, in New York City.
Sure, yeah. So when we talk about social determinants, we're talking about the other elements of your existence that play into your health, right? Because health is not just a matter of your biology. It's a matter of your family structure, whether or not you have enough income to support your lifestyle, whether you have legal issues, housing issues. So all of these things, the conditions of your environment play into your health. Likely more so, arguably more so than your inherent genetics. All right, now I know everyone talks about genetic predisposition. I think that's that's overdone. Really, what the cause of most disease, the diseases that we will eventually succumb to, the heart disease, the liver disease, kidney disease, diabetes, high blood pressure, cancer, these are almost entirely preventable, all right? Genetic predisposition accounts for maybe 5% amongst all of these things, okay? So what the point in that is, we can prevent these things if we take the proper precautions, if we go and we see our physicians earlier, if we start to establish a lifestyle and make decisions that's consistent with healthier outcomes, all right? So, you know, and that doesn't begin when you're of older age. You know, we have, you know, you're not old, you're seasoned, you're experienced, right? What they say, the older the berry, the sweeter the juice? Is that how it goes? Or the blacker the berry? Whatever. Older the berry, the sweeter the juice, all right? Whatever. You all have, I think, the responsibility now. Being in this room, to me, tells me that you already know what needs to be done. For the most part, you're taking accountability for your health. You took out time out your day to walk over here and be part of this event. So it's not so much you that needs to hear this message. It's the people who aren't in this room, the younger generation, the men. We're the ones who need to hear this message because we're the ones who succumb to disease at a much higher prevalence, okay? And healthy aging doesn't begin when you're of older age. Healthy aging actually begins at birth. But when we talk about, you know, when things actually start to begin to happen, I start seeing patients at the age of 18. That's when they should be seeing their doctors at least on an annual basis so that we can get ahead of the game. Because if you can prevent disease from occurring, you don't have to treat disease later, all right? And so I impress upon all of you to talk to your loved ones, especially your kids, your cousins, your nephews, the men in your life. Start to get them in to see the doctor earlier on. And just to take it back to the whole social determinants, to me, you know, that one of the biggest challenges that we still have yet to truly been able to overcome is the impact that stress has on our overall health and wellness, right? We can talk about the biology, but how do we manage stress, right? Because your genetics that's not the only thing that you inherit from your family, right? You inherit their stress coping mechanisms or lack thereof, you know, their vices, the drinking, the smoking. So how do we manage that, right? And not everybody wants to go and speak to a therapist. I'll be honest, I'm one of them, right? But what helped me was getting involved in some of these other alternative therapies. I'm a big fan of massage therapy, acupuncture, sound healing. I did ayahuasca when I was at the worst place in my life. I went to Peru and did ayahuasca, which some of you may not have heard of. It's a psychedelic, right? So when you hear about shrooms and things like that give you this altered level of consciousness, well, that helped me spiritually, emotionally, and then the physical aspect followed suit. And I think these sort of topics we have to reintroduce to our community because a lot of these things, cannabis included, the psychedelics, these actually derive from African nations, okay? But we look at it as, you know, the devil's weed, something that we don't want to really entertain because of the perception that it leaves you altered and leads you down a pathway of drugs. But if used appropriately, once again, they have a vast array of therapeutic benefit, okay? I know this community suffers from a heroin and fentanyl epidemic. Well, there's a psychedelic called Iboga that comes out of Gabon in Africa, where one dose cures opiate addiction, cures, not manages, not what methadone does, cures without the withdrawal symptoms. But I'm sure many of you have not heard that because this is information that's not being provided and circulated in our community. But providers like myself, we're here to do it. So we have to have an open mind to it, have the conversation, and I'm here all day, so you can come talk to me about it.
Thank you. Dr. Damberville, he is really going to be here all day, folks, so take advantage of that. Dr. Damberville, I want to speak to you about something Dr. Hinson raised, intergenerational trauma. It is something that just being part of certain communities, being in certain ethnic populations, this happens to us. Just want you to speak to that a little bit, recognizing it, and some of the best ways that we might be able to address that.
Sure. So you had mentioned stress, right? Life can be very stressful, and it definitely takes a toll on our mental health and the mental health of our kids. And so if you think about intergenerational trauma, just intergenerational stress, we do pass that on in our genes, but also the environment. So social determinants of health can be something like you want to quit smoking and you're really motivated and you're making change, but then you go back home and in order to walk from the clinic to your apartment 3 blocks, you're passing 3 stores with a lot of marketing for cigarettes. That just makes your path to sort of conquering addiction that much harder. If you want to come to mental health treatment, but you don't have money to pay for a MetroCard, if your mom wants to take a kid to therapy, but they have 3 other kids and no money for babysitting and grandma's sick or they're taking care of someone. So all of this and all of the stuff that happens in our world, so all the trauma that we see on the news, right, the deaths, the wars, all of this takes a toll. And then we as an individual, you as a caregiver for a child or a teen are carrying that stress and trying to just get through the day. It makes it really hard. And I think with children and teens that their suffering can often be invisible, right? Like we want to protect them and protect their innocence. And so sometimes we can look at it and say like, they don't have any worries, but they do, right? Because they're living in the same world that we are living, and this world is stressful, especially post-COVID. And so we want to take their worries seriously, and we want to also prevent mental illness in the future by really strengthening their mental health and wellness from the start, right? And so understanding and having the mental health profession understand what mental health even looks like for your community, right? Like how does your culture define wellness? How does your culture define family? How does your culture define coping? And we want to make sure that we integrate those practices into the care that we provide you and your family, because we want it to make sense for you. We know that it's not a one-size-fits-all approach. Yeah.
All right, thank you. I think absolutely. We hopefully can get to a few questions shortly. If there are some questions, I think we'll get there shortly. Just wanted to make sure that we do. But Dr. Drulinski, I want to ask, what are some of the considerations that as we age, that we want to continue aging healthy? What are some of the considerations we should be considering around preventive screenings or addressing, preventing cancer from coming on altogether? Some of the things that we can consider around there.
Okay, thank you for the question. So one thing is that we're all getting older, and unfortunately, as we get older, cancer is more common. There is a link between cancer and aging. So there is no limit to getting mammograms. There is no limit to colonoscopy. There is no limit to PSA screening if you're healthy. It really depends on how we are. So I just wanted to, again, encourage screening because, again, cancer risk goes up, not down as we get older. And I just wanted to add to what everything was mentioned about telehealth, that if you're afraid to see a doctor, oncology, endocrinology, all the services, specialties offer telehealth as well to alleviate fear. So there's a lot of ways of getting into the medical system.
Thank you so much. I saw a hand up for questions. I think there are a couple of mics, so you can start coming to the mic, if that's okay, Deidre, and we will take some of the questions. You can go ahead, ma'am.
Oh, sorry. Good morning, and thank you for coming out. I just want to acknowledge the link for the Breast Examination Center of Harlem that's been here offering free mammograms and PAPs for a long time, and the connection between that, Mount Sinai, and Ralph Lauren. And then because I heard you all talking, and one thing that's very necessary in the Black community is patient navigation. Today, I have not heard one single person talk about that. And even if we're going to a doctor, sometimes and we're diagnosed with a particular, I used to teach school. So, and you're diagnosed with a particular condition, you don't know what to do.
Yes.
And patient navigation, I think, needs to be discussed. And for the oncologist, just so I can do everything quick, I haven't heard anybody today mention biomarker testing. It took the American Cancer Society and other organizations about 4 or 5 years to get that law passed to say that biomarker testing is available now. And people don't even know what it means. And it's very important for the people that sit in this room. Thank you for listening.
Thank you very much for your question, Dr. Julinski. I'll ask Dr. Julinski to speak to the biomarkers and some of the work that's happening there.
Yeah, I mean, patient navigation is crucial. Jamaica actually is doing it really, really well, and we need more of it. Genomic profiling is genetic testing that's done in the bloodstream. It's a little bit in its infancy, meaning it's a little bit early. Hopefully in the next few years it'll be more available and more useful. It's not really mainstream yet.
Thank you. Just to the point of patient navigation, that's to make sure that when you go one space and they refer you to another, you get there. And that's important, right? And part of it is this relationship between the organizations. No one organization can do everything for you. And being able to ensure that you're going from one to the next is important. And sometimes you need help, right? And I think one of the earlier presenters was speaking to the fact that there are certain cabs that can come and get you. So the Hunter School of Social Work has a patient navigation program. Many of the public hospitals have patient navigator programs. There is something called community health workers. Some of you in here may be community health workers. Those are very helpful in getting you get connected to one space to the next, and literally sometimes walking with you to the next space. So thank you very much for elevating that. And we'll get to certain more about that, but well, thank you. I'm gonna go here for another question. We can't hear you. Is that Michael?
Can you hear me? Okay,
Yes.
thank you. I wanted to talk to the two doctors on the right. Have you heard of the organization called Mentoring in Medicine? Mentoring in Medicine. Okay.
Yes.
You have?
Yes.
Okay. Basically, that obviously they help with assistance, resources, and also advocacy and mentoring for college students that are entering the healthcare system. And if possible, would you like to collaborate in some type of way?
Yeah, absolutely. I know. Mentoring Med, that's Dr. Lynn Holden's group.
Yes,
Yeah,
yes. I'm
yeah,
on the
familiar.
advisory board, so
Oh,
I'm
okay, yeah, I know
definitely
Dr.
wanting
Holden.
to see how we can invite you to our home, and we can make the home bigger. Because a lot of our students are being strategically diverted into not completing their degree or continuing to medicine. And that's why there's not, our faces being seen, is because once they get into the residency, they're being discouraged, they're being bullied, or they're being diverted to go somewhere else. So I just want to say thank you to the both of you for actually making that journey and the face of medicine, but within people of color. Thank you.
Appreciate it. Yeah, and just hopefully I can get your information. But yeah, we're actually so the flagship is at Cornell, Black Latino Men in Medicine, but we have a site at opening a site at LIJ, and we're at man, it just escaped me. What's the CUNY school? Hunter, yeah.
All right,
Can I just add that one thing that's important for creating that pipeline, not just kind of making sure that people who are already here succeed, but also that the systems around it support someone choosing to go into psychiatry, psychology, social work, or mental health. And with insurance and costs, like it's hard for people to access services. It's hard for people to feel like while it's a worthwhile profession, people also need to pay their bills, and people want to get paid for the years and years and years of learning and training that they do. So I just want to put out there that we really want the community to support in like advocating for mental health services across the board at various levels, particularly around funding and insurance change, and making it more accessible so that people feel like this is a career, not just a job, but a career that they want to choose and stay in.
Thank you. Ma'am?
Hi, this is for the whole panel. I had a CT chest scan for lung cancer. My pulmonologist directed me for this test. Now, this is a test that x-rays or scans your neck to your stomach, and it tells you every organ from your neck to your stomach. And I never hear you didn't mention that. It's a free scan for every year you can get tested to find out if you have lung cancer. And it also tells you about every organ from your neck to your navel. And I've never heard anyone talk about this. And why are you not offering this service at your clinic?
Yeah, so definitely for patients who are former smokers, lung cancer screening is approved by every single insurance. So I'm glad that you had one done. And everyone
But do
who
you
has
offer
it,
that at your clinic? And why are you not suggesting that to most of
Yeah.
us smoked or been around
yeah.
secondhand smoke?
So we do offer it, and internal medicine practices offer it. And anyone who has a history of smoking should talk to the regular doctor about it, because lung cancer is the #1 cancer in men and #2 in women.
And
So
this
absolutely,
is also early prevention.
absolutely, I'm glad you mentioned it.
Thank you.
Thank you.
Thank you for elevating that. I appreciate that.
And just to piggyback on what was said, so not every test should be given to every patient. I think we need to understand that. Just because the test is available doesn't mean that you need it or that you should get it. CAT scan sounds great if you meet criteria for it. So former smoker at increased risk, secondhand smoke exposure. If they find an incidental nodule on a chest X-ray, then we might want to do CT scans. But understand that a CAT scan is radiation. So you don't want to expose yourself to unnecessary radiation. So this is why I make the point that not every test is for every patient, but if applicable, if you meet the criteria, absolutely. And that's a conversation that you should be having with your primary care physician. But you have to have a primary care physician and see your primary care physician in order to get access to that information.
And we all could do a better job in helping the community learn about health education, right? And educating about tests and what questions to ask your doctor, how to access a therapy service. So I think that's also on us as a profession to make sure that we're getting this information out there, so it doesn't feel like you're finding this thing out later in life when it's already been there. So we do want to make healthcare accessible.
Thank you. Sir, please.
Good afternoon.
Good afternoon.
Thank you for being here. I traveled from the borough of Brooklyn, and it's been nothing but a pleasure to be here and see all the people that are giving out information and help. My question to you, it's a short question. I thank you for being here and in Harlem, but when will you be coming to Brooklyn and the other outer boroughs?
So there is a Mount Sinai Brooklyn location. I will say that.
Black Health Matters, I understand, goes across the country. So that's definitely an opportunity to bring that information to those different locations. The Department of Health has a location in central Brooklyn, the Brooklyn Neighborhood Health Action Center, that can provide a lot of the information and resources that you're hearing up here.
Yeah, I'm actually heavily involved in the Brooklyn area also, so and we're not too hard to find. In fact, My brother here, Chris Williams, he runs Heart, Body, and Soul. He does a Black Men's Health Festival in June in Brooklyn. Say it again? Where's the location? I can't recall the name of the place we were at this past summer, but we do this every June. This is my brother right here. Say it again? The name of his organization is Heart, Body, and Soul. The name of my organization is Metal Roots Medical Group. You can find us online. So if you have access to the internet, you have access to us.
Yeah, Dr. Hinson as well as Chris is going to be around later, so just look them out. You can get more information about some of the activities that is happening in Brooklyn, as well as some in the other boroughs. Obviously, the challenges is always staffing and resources, but we always want to be able to make sure that wherever you are, we are coming to you. This is part of the reason why the Department of Health has some of the buildings they do, because we have recognized that certain neighborhoods, the health disparities is much worse than in comparison to other neighborhoods. And it's important for us to go into those neighborhoods. If you were to look at some of the maps of redlining, right, and you laid over where we are seeing some of our negative health outcomes, it's almost a perfect match, right? So what happened 100 years ago is having an impact today. So we need to be investing in our communities today, right? So that's why we are here today. We're going to be in Brooklyn in some other way, in Bronx in some other way. There is an action center in the Bronx as well, in the South Bronx. I'm quite sure Mount Sinai and MSKC has various locations across the city. And so we recognize the need to be, not for people to have to come to us, but for us to come to where the folks need the assistance. Thank you. I'll go over to you, ma'am.
I actually don't have a question, but I'm enjoying the seminars thus far. The young lady back there, would you mind if I take the mic to her, or she has a question?
Sure. While you're doing that, we can take someone else so that we can get her question after.
Okay, I'll do that. I'm the spokesperson today.
Yes. Good day to everybody. This question is for the medical oncologist.
We can't hear you.
Can you speak a little closer to the mic?
Yeah. My question is for the medical oncologist. Thank you. In your practice, have you ever seen patient with recurrent breast cancer develop a rash at the site?
Yes, it can be, breast cancer can spread to the skin, so that's called skin metastasis. Sometimes it's a rash unrelated to cancer. So usually that person should discuss it with their oncologist, and sometimes it requires a biopsy.
Well, in my case, it was recurrence of breast cancer. When I spoke to the radiation oncologist, she was not very happy. She said she has never seen that in 33 years of her practice.
Yeah, it's very common, and I would encourage you to talk to the medical oncologist because it's not treated with radiation, usually.
Okay, thank you.
Yeah. And Dr. Jolinsky, maybe she can have a conversation with you after.
I'm happy to talk to you afterwards.
Just to be able to address that. I believe we have a young lady in the back.
Yes, thank you. Good afternoon. I thank the young lady right here.
Yes.
I'm disability, and I'm concerned about the treatment for disability in elders and seniors. I've been with young people for the last, 40 years, all over New York, and when we talk about the health of young people, if you go into the gyms and the schools, you'll wonder why they're sick. You'll also wonder why they got more fast foods and parents are not cooking as they should. But also some diseases have been misdiagnosed. And by the time you get through, they done threw medicine at you. They done found out that you didn't need that medicine, but medicine has a side effect. I would agree that the natural way of curing, not only having God in your life, He'll give you a signal somewhere, somehow, your intuition will tell you that you're sick instead of avoiding it. But what happens is that sometimes you go to places and they're very nasty people. And I always say, don't take a job dealing with God's most precious commodity, which is a human life.
Indeed.
Because you don't know who's coming through that door, and when you misdiagnose them, my question is, last year we were here. I'm still wearing my bracelet from last year. We had a tremendous time,
Yes.
but we're still finding out there's poor communications with hospitals. Hospitals are closing down, and they got more high-rise, but when people go into the hospitals, you gotta wait 3 and 4 months to see a doctor, even a specialist. We gotta stop that poor treatment. We need better communications. We all have to be advocates towards one another. We should care about each other, be compassionate. Now, I'm not saying that it's fun being in a walker, but because of the fact that I am in one, because of the fact that I was misdiagnosed with diabetes, I have compassion for other people. And I want them to understand that because I'm here, I know somebody else is going through, but not having a voice. Please, we need more push in our communities. We don't need to be rocket scientists. Some of this stuff is not new, but we need to be due diligent and doing our part. We got a young generation behind us. Some of us made it 67. We got kids dying younger than that. Senior citizens need their families to go with them to the hospital. We have the home health aides. Thank God for that. I just want to thank you again for another wonderful forum, and hope we can get around this country and get this dealt with.
Thank
Can
you.
I fill that room?
Thank you so much.
Because I think our queen here brought up
Amen to that.
a few really important topics that I think the direction that medicine is going will help to address. One, you mentioned the long wait times to see a physician. You also mentioned the disability and how that plays into you being able to access your providers. And I think this is where telemedicine really comes in to play, because you having the limitation on being able to go into the hospital should not preclude you from being able to see a doctor and getting high quality health care. And a lot of primary care practices now are implementing this virtual care model that also includes what's called remote patient monitoring, which are the use of devices like a glucometer, blood pressure cuff, or scale that you can use in your home, and that every time you use it, that information gets sent to your doctor, so that now your doctor has real-time information on what's going on and can make the best clinical decisions for you, which is actually better than you going to see the doctor in their office, because you can only go in to see them every few months or so. And so these sort of things, these sort of technologies that are now being introduced may actually address the very specific concerns that you have. The other element that you brought up was you believe that natural therapy is the best way to go. And you know I had to jump in on this one because I think it's most certainly a combination of the two. Okay, now understand I'm fully indoctrinated into this Western medicine system. However, I do not believe in pushing pills. I don't think there's a pill for every ill. It has its place. It has its place, but there is nothing that man can create that comes remotely close to the power of God. And we do have to start getting back into introducing natural therapies, herbal therapies. We come from the earth, and therefore we should consume things from the earth as well. But you have to go to someone that actually knows what they're doing. All right, there are far too many quote unquote certified herbalists. You know, you getting a 30-day online course and degree does not certify you to actually manage someone's chronic conditions using plants. All right, so we, do your due diligence in finding these other practitioners, but also incorporating things that I mentioned before, like the sound therapy and the aromatherapy, the acupuncture, the massage therapy. Disease is a systemic process, and so it has to be addressed in a holistic manner. A pill does not address the body in its entirety. So we have to start incorporating these other elements as well. So I appreciate your comments and concerns.
Thank you so much. I have to say I'm sorry. We only can take the last 2 questions, but you can definitely have a direct conversation with the panelists after. Ma'am, you're next.
Thank you for the forum. My name is Malika Shabazz. I'm from Queens. I just wanted to hear a little more about this medication that you was talking about in Africa and what part of Africa they have this medication that's cured and why we don't have it and what we have to do to get it.
Yeah, I appreciate that. So the plant is called iboga. Okay, iboga is a psychedelic, just like ayahuasca is a psychedelic brew. You may have heard shroom, psilocybin is a psychedelic. We're even using ketamine now, which is a synthetic, but it has psychedelic properties. It comes out of Gabon, all right, and they've been using it for millennia. The reason why we don't have it is political. It's illegal in the US. However, it is legal in some places in Europe, some places in the Caribbean, Mexico. But I'm part of a committee now that's trying to bring this to the forefront of our politicians so that we can start passing the necessary legislation to have access to these type of medicines. You know, again, we have to frame them as medicines because anything can be a poison or a medicine. The only difference is the outcome. All right, so if you use these things appropriately, they can be incredibly therapeutic. And I think when we talk about the issues around the opiate crisis and what we see in Harlem, I mean, it could be completely revolutionary. We don't need more methadone clinics. What we need is more curative therapy. All right, so.
I want to add that there are a lot of treatments with, there are a lot of people using psychedelics and other substances to treat mental health conditions. For example, ketamine for depression, or individuals who've tried other therapy, other medications, and their depressive symptoms are resistant, that's been effective using medical cannabis for PTSD. And so there are a lot of things in the US being done here that's been studied for quite some time that are already established as safe and effective for mental health treatment. So it's not that everything is a drug and it's sort of outside of our hands. There's a lot of accessible mental health treatment that do involve those substances in a safe manner.
Thank you, Dr. Danberville. Maybe you can ask Dr. Danberville later on in terms of more information around that. Ma'am?
Good afternoon, everyone. My name is Colette Smith, and I traveled from the Bronx to be here today.
Thank you.
Someone on the panel mentioned a statistic regarding lung cancer being the #1 cancer killer. I'm a 9-year survivor living with an upper left lobectomy, never smoked, and I want to hear more discussions and more actions regarding screening guidelines for never smokers, or even testing for never smokers.
Part of that is social determinants of health, right? So your environment. So you or I may not have been smokers, but living in New York City, the CO2 levels are higher because there's so many more people here. The smoking policies in public housing, private housing, and so that's an example of how you might not have been using the substance, right, but that you are affected by it and it affects your health. I just wanted to point that out.
And I just want to talk about symptoms. So you wouldn't have fit the guidelines, right, for CAT scan screening that we talked about. In terms of cancer, I would say that symptoms that come and go, we usually don't worry about, but symptoms that are persistent, you should bring to a doctor's attention. So for example, if you don't have a fever, but you have a cough that's persistent, that might be a symptom of a mass in the lung. So it's something you should bring to an internist, to your regular doctor, and that might prompt a chest X-ray or CAT scan or something. So a symptom that's steady and persistent, it's something you need to bring to a doctor's attention.
Thank you. We'll take the last question.
I really appreciate that. I came all the way from Queens.
All right.
Dr. Henson, I see you over here. You talked about environmental issues. You talked about the fact that we need to be thinking about those. You talked about CO2, but are we also addressing what we're eating? How many of you can actually say that you'd be willing to remove sugars, and change your diet completely? Because I believe it's in the what we eat that actually trigger a lot of these, these diseases. If the body is alkaline, if the body is healthy, then no disease can live in it. But if we're feeding it constant foods that will inflame our body, then we will always have these sort of issues. And so my question to you all is, are we looking to, when we're treating our patients, are we also talking about ways that we have to change our diet and talk about like actually removing foods that can cause inflammation as opposed to just giving them medication? And I know, Dr. Henson, you're doing the right thing, brother.
Thank you very
Thank
much
you.
for that question. We appreciate that. Food as medicine. Can you speak to that point?
Food as medicine actually plays an important role in mental health, right? Because the way you take care of your body and your brain is also going to affect your emotional well-being. So I am not a nutritionist, a dietitian. I don't give that advice, but even as a therapist, I talk about the role of sleep hygiene, food practices, food and your mood, especially for kids and teens who are still, one, don't have control over their food choices, right? Like they're being fed by their families, so there's culture around food, there's, thoughts and feelings around food, food related to, body image and self-esteem and weight management, all these different things. And so food does play an important role in mental health, and it's important to allow people to make the choices that they want to make in their lives for their families. So it's a delicate balance. But we do promote healthy eating because we want a healthy mind.
Yeah, so I'm a student of the late Dr. Sebi, right? Not in actual practice, but in spirit, because a lot of what he spoke about 40, 50 years ago, science is just now beginning to confirm, right? One of his quotes was, mucus is the cause of all disease. You get rid of the mucus, you get rid of the disease, right? We're starting to understand that more. He was alluding to something, because where does mucus come from? Mucus is a byproduct of inflammation, all right? And it's chronic inflammation that causes most of the chronic disorders which we will succumb to: diabetes, high blood pressure, heart disease, dementia, depression, anxiety, cancer. These are all disorders of chronic inflammation. Our diet most certainly is our greatest source of inflammation. This high fat, high processed, high meat, high dairy diet is highly acid forming and inflammatory, okay? So when we talk about chronic inflammation, yes, we can talk about the diet, we can talk about stress management, we can talk about infections, we can talk about poor flow. All right, this is why I said getting acupuncturists and chiropractics and massages is important, because when you don't have good blood flow and lymphatic flow, all of those toxins build up, so you got to get that moving. This is why getting out and having physical exercise is important. Getting the sun is important, okay? You don't just get vitamin D from the sun, you get human energy from the sun. This is why when people don't have access to the sun, and actually we see it every winter, people get what's called SAD, seasonal affective disorder, all right? So we see a direct correlation between sun exposure and mood and mental health, all right? So we have to get back into, this is what I mean, we have to get back into what's natural. All this on the phone, is interesting. The American Academy of Pediatrics put out a study in 2022. They did a 10-year study looking at the number of non-fatal injuries and falls in the youth, right? So over that course, we've seen an increase in suicidality, but over that same time, we saw a decrease in the number of childhood falls and injuries, which sounds good on the surface, but why is that? Because our kids aren't going outside. They're not running around. They're not falling. When I was a kid, I broke my collarbone twice, being stupid. I'm playing tackle football on concrete, but I was outside, right? You couldn't wait to be outside. Now, all of our kids are indoors. So not only are they lacking physical exercise, but they're lacking exposure to the sun. And we see all types of disease states as a result of vitamin D deficiency. And we're already being heavily melanated people, we're already at increased risk for that, okay? So we have to get back into its natural, healthy sun exposure, eating alkaline, plant-based. I try to stay away from plant-based, because even plant-based foods can be highly processed, but eating alkaline, okay? I always talk about, hydration is equally as important as all these things. Sometimes, bottled water is not necessarily the best water because of all the microparticles that exist in it, and the fact that this is not the most hydrating source of H2O. The most hydrating source of H2O is actually found in your fruits and vegetables. So essentially you should be drinking or eating your water, I should say. So we have to get back into understand these various principles and build them into our medical regimen.
All right, ladies and gentlemen. We could drop the mic on that one. Thank you so much for being here today, for listening to our panel. Thank you, Dr. Drulinski, Dr. Hinson, Dr. D'Amberville, for all that you have done, for the information you provided. They are around. You can definitely get more information from them. Thank you so much for being here, and we look forward to continuing the program.